Bismillah Rahman Rahim. Today a video will have introduction to our new center, which is Center for Simulation and Innovation. Rawalpindi Medical University was established in May 2017, and since that our team has a vision which is about 15 years, and this vision was to upgrade a medical college to the university according to the international standard and guidelines. One of the component was to develop new infrastructure and new program, and one of that structure is Center for Simulation and Innovation. And today we will have just a tour of this center, which is unique in Pakistan to RMU only. The concept of Center for Simulation and Innovation was perceived in 2019. Initially, a paper, which is concept paper, was formulated, and based on that paper, later on a PC1 was structured for the federal government. Alhamdulillah, this PC1 was finally approved in 2021, and but still there was a delay because of the allocation of the funds. Finally, for simulation and innovation center, about more than 1 billion funds were allocated. The work started in March 2023, and within short span of 2 years, this building was constructed with more than 450 million rupees, and the equipment was purchased for more than 500 million rupees. And now from last 2 weeks, which is basically was the April, we have started this lab in the functionality mode. I will show you what is the, I'm standing on the reception. You can see here the different offices of the director of Center for Simulation and Innovation. There are meeting room, there are teaching rooms, and you can have a centralized monitoring system of this lab. CSI infrastructure has a ground floor and 3 floors above that. We are just standing into the ground floor, which is one part of the low fidelity lab of CSI. This have the basic modules, the basic equipment, the mannequins and models. Here we can train the undergraduate and as well as the postgraduate on basic life sports, advanced life sports, and many other basic procedures. You can see behind me there is all site of mannequins are available. Further, we have started this undergraduate program from last 2 weeks, and this is a part of curriculum. This is well documented and as a weightage in as an annual or the summative assessment. Soon we will take you around to the mid fidelity lab, which is the 2nd floor, and then we have a 3rd floor where we have a high fidelity lab. The mid fidelity lab will have the equipment like radiology, the gynae labs, and other specialties, but here mostly it is for the postgraduates or the specialties. But the high fidelity lab is specific to the faculty training, and it has an advanced phantom lab. It has the mannequins where you can use the AI for the learning as well as assessment model. According to the modern teaching, which is now called as a outcome-based medical education or competency-based training, it is mandatory in the international institution to have the simulation and innovation labs, because this lead to a quality training as well as a safety of the patient cares, that before you go to the patients and examine them, and particularly you do the procedures, then you must be well certified by the simulation lab. So that's the what Rawalpindi Medical University is doing. As a part of infrastructure tour of the Center for Simulation and Innovation, we are on the 1st floor of the lab, and this is the anesthesia and critical care unit, and you can see here the different human bodies and mannequin and models which are used for the advanced life sport as well as the basic life sports. We will discuss the whole process and operational mechanism of this portion of the lab, which is mid-fidelity lab, in the second video, inshallah. And you can see just opposite to this is the where the whole training can be monitored by the tutors as well as by the simulationists as well as by the teachers. Now we are in the BLS lab. I will discuss the operational details as well as the teaching model later on, but you can see here how we can, this is Mr. Alex, and we can use the whole patient history taking and examination, which is purely AI model. So now we are another part of our Center for Simulation and Innovation, and this is trauma management or trauma emergency dealing mannequins, and here the undergraduate, postgraduate and faculty will be trained, and they will learn the management according to the international standard and then can apply this to the patient. So now we are in the nursing lab, and this is the model or the mannequin, and have a software how to do the nursing care, like bed sores, like colostomy, like mouth care and many other things. And we can learn this and practice it, and the nurses will be assessed and then they will work into the intensive care unit in the hospital. This is another model for the nursing care, and it is taking care of a unconscious or bed-bound young patient that was relatively geriatric patient, the old patient. This is interventional simulation lab, which is a component of Center for Simulation and Innovations, and this is the real-time anatomy table, which is purely digitalized and AI based, where the undergraduate, postgraduate and even the scholars who are doing PhD, they learn not only the structural anatomy but the application of anatomy. So there will be debriefing also, so we can study the model and then do the debriefing and assessment also. So now we are in a part which is called the Phantom Lab, and this model is to teach the radiology, particularly the ultrasounds and 3D radiology. Intrauterine defects can be detected. Other training, software can be used. Different sort of teaching modules will be structured and purely used by the gynecologist, radiologist, and specialty training, even by the specialty like hepatologist, how to look at the HCC, how does it look in the 3Ds, how you can diagnose the intrauterine defects. This is very interesting. This is maternal and fetal simulation lab, and this is real time. You can study the physiology of pregnancy, even the normal body, and then you can have different ways of normal debris, breech debris, the resuscitations of the neonate, a newborn, and many other. And you can treat even if there is something complication like arrhythmias will need cardioversions. So I think we will come up with the details of different teaching modules and their difference and their assessments. Thank you.